Education is not the filling of a pail, but the lighting of a fire. A very good afternoon to one and all. It gives us immense pleasure to welcome you all to this online guest lecture on therapeutic diets in hepatic disorders, organized by the PG Department of Food and Nutrition, Bishop Heber College, Trichy. Commit to the Lord whatever you do, and He will establish your plans. To invoke God's blessings for this program, I invite Miss C. Krista, 3rd BSc Nutrition and Dietetics, to lead us in prayer. Heavenly Father, with grateful and humble hearts, we come into your presence. As we begin this online guest lecture, we thank you for this day and for bringing us together for this meaningful webinar. Lord, we place before you our esteemed chief guest, Dr. R. Shobana Devi. Bless her with wisdom, clarity, and strength as she shares her knowledge on therapeutic diets in hepatic disorders. We also seek your blessings upon our respected head of the department, Miss Siroslan ma'am. Grant her good health, wisdom, and guidance as she leads our department. Bless our faculty members and students. Open our minds to learn and our hearts to grow through this session. We commit this program into your loving hands and ask for your presence throughout. In your precious name we pray. Amen. Thank you, Krista, for your prayer. A warm welcome is the first step to meaningful learning. I now invite Miss M. Divya Bharati, first M.Sc. Food Science and Nutrition, to deliver the welcome address.
Proper nutrition is the foundation of disease prevention. Good afternoon, one and all gathered here. It's my honor and pleasure to deliver you all a welcome address on the online guest lecture organized by the PG Department of Food and Nutrition, Bishop Weber College. I extend a warm welcome to our resource person, Dr. Shobana Devi ma'am, women scientist, CMC, Vellore. We are truly grateful to have you with us today, ma'am. I'm glad to welcome our head of the department, Ms. Roslyn ma'am, for her constant support and initiatives in organizing this session. I would like to welcome the organizing secretaries, Ms. Shampavi ma'am and Ms. Redita Angel ma'am, assistant professors. I also welcome our teaching and non-teaching staff faculties of our department who constantly support us in all ways. A huge welcome to our beloved students who are eagerly awaiting for the lecture on therapeutic diet for hepatic disorders. Once again, I welcome you all.
Thank you for your gracious welcome. To be inspired is great, but to introduce an inspiration is an honor. I invite Mr. S. Danush, 3rd BSc Nutrition and Dietetics, to present the Chief Guest introduction.
Good afternoon, all. It's my great privilege and honor to introduce the esteemed guest speaker, Dr. R. Shobana Devi, ma'am, a distinguished academician, researcher, and nutrition professional, as the guest lecture for today's guest lecture on therapeutic diets in hepatic disorders, organized by the PG Department of Food and Nutrition, Bishop Weber College. Dr. Shobana Devi, ma'am, holds an M.Sc, M.Phil, and Ph.D. in Food Science and Nutrition. She completed her Ph.D. in Food Science and Nutrition from Periyar University, Salem. She earned her M.Phil in Food and Nutrition from Vinayaga Mission University, Salem, and her M.Sc in Dietetics and Food Service Management from Indira Gandhi National Open University, New Delhi. She completed her postgraduate diploma in dietetics from Christian Medical College and Hospital, Vellore, and her BSc in Nutrition, Food Service Management, and Dietetics from the University of Madras. She is also a UGC NET qualified professional, a registered dietitian, and a gold medalist recognized for her academic excellence. She is currently serving as a women scientist, postdoctoral fellow in the Department of Medicine at Christian Medical College, Vellore, one of India's most reputed medical and research institutions. Her past work experience include serving as assistant professor and head of the Department of Nutrition in reputed women colleges, junior grade dietitian, clinical dietitian, and associate research officer at CMC Vellore, contributing extensively to academics, clinical nutrition, and research. Dr. Shobana Devi ma'am has an impressive record of research publications in reputed national and international journals, including British Journal of Nutrition, Journal of Food Processing and Technology, International Journal of Food and Nutritional Sciences, and Annals of Food Science and Technology. Her research focuses on millet processing, polyphenols, antioxidants, cardiovascular health, diabetes, and she has also authored books on food science and technology and plant-based nutrition, reflecting her commitment to knowledge dissemination. She has actively participated in numerous national and international conferences, seminars, workshops, and symposia conducted by prestigious institutions such as AIMS New Delhi, Jawaharlal Nehru University, Periyar University, VIT, and CMC Vellore under the Indian Dietetic Association. She has presented research papers on platforms, winning first prize awards and for oral and poster presentation for her scientific contributions. In addition, she has played a pivotal role in organizing national health conclaves, international workshops, state level webinars, and academic programs related to nutrition, lifestyle, medicine, food product development, and public health. Dr. Shobana Devi ma'am is also highly respected invited speaker and guest lecturer, having delivered expert talks at medical colleges, engineering institutions, arts and science colleges, and hospitals, addressing topics such as nutrition prescription, women's health, food labeling, immunity, lifestyle diseases, and diets, myths, and facts. With her exceptional blend of academic excellence, clinical expertise, research contributions, conference engagement, and public outreach, Dr. Shobana Devi ma'am continues to inspire students, educators, and healthcare professionals alike. We are truly honored to have such a distinguished personality grace our program today. Let us extend a warm and respectful welcome. Thank you all.
Thank you, Dhanush, for your introduction. Knowledge shared is knowledge multiplied. We are honored to have Dr. R. Shobana, M.Sc, M.Phil, Ph.D, PGDD, RD, NET, CMC Vellore as our esteemed chief guest. I now invite Dr. R. Shobana Devi to deliver the guest lecture on therapeutic diets in hepatic disorders.
Shobna ma'am?
Am I audible now?
Ah, yes, ma'am.
Yes, yes. So you haven't heard me before?
Yes, ma'am.
Thanks for yes. Thanks for this wonderful opportunity. I would like to take this opportunity to thank Dr. Rosalind ma'am for giving me this wonderful opportunity for to share my insights on liver disorders to your students. So let us start. So liver disorders, we know that it refers to the group of conditions that impair the normal structure and functions of the liver. Liver, we know that liver is a metabolic organ where all the metabolism takes place, right? So liver, it's a place where the metabolism of carbohydrates, proteins, and fats have been taken place, and detoxification is also occur in the liver only. All the harmful substances will be detoxified in the liver, and synthesis of plasma proteins occurs, and storage of vitamins and minerals. So liver is the main organ where all those things, metabolism, synthesis of protein, and storage of vitamins and minerals will be happen. So liver, when does the liver disease arise? It might be due to some infections, or due to some metabolic abnormalities, or due to the excessive alcohol intake. Am I audible to everybody? Rosalind ma'am, is it audible? Everybody can follow?
Yes, ma'am.
Yes,
Yes, ma'am.
yes,
Yes,
yes.
ma'am.
Okay. Any doubts or anything? You just let me know that I'll stop. Okay.
Sure,
So
ma'am.
liver diseases, yes. Liver diseases is arise due to the infections, metabolic abnormalities, excessive alcohol intake, and also very particularly due to the not be reversible. So since the liver plays a central role in nutrition and metabolism, liver diseases often lead to malnutrition. It altered the nutrient utilization and systemic management, a crucial component of prevention and treatment of it. So let us enter into the different types of liver diseases and its types, causes, and symptoms. And I have prepared the notes also. And at the end of the session, I will share the notes to Rosalind ma'am so that students can get the notes from Rosalind ma'am. Okay. So let us see the liver disorder. The first liver disorder is a fatty liver disease. Under fatty liver disease, it can be categorized into alcoholic fatty liver disease and non-alcoholic fatty liver disease. Hope you would have heard about NAFLD. What is NAFLD? I just want it should be an interactive class so that I will also get an idea that you people are following and you have got an you have understand the topic. Okay, what is NAFLD? Anyone? It is a non-alcoholic fatty liver disease. So the number one liver disease is a fatty liver disease. It is categorized into two types. First one is non-alcoholic fatty liver disease, and the second one is alcoholic fatty liver disease. So the first one, non-alcoholic liver disease, fatty liver disease. It's what is the cause of disease? It might is caused due to the excess calorie intake, and it may be due to the obesity and insulin resistance, and may also due to the type 2 diabetes. And when you consume high refined carbohydrates, when you consume high fat intake, that will also lead to the non-alcoholic fatty liver disease and the sedentary lifestyle. What is sedentary lifestyle? Without any physical activity, all those things will lead to non-alcoholic fatty liver disease. These are all the causes. And when you come to the symptoms, the symptoms of this non-alcoholic fatty liver disease is often asymptomatic. So what is often asymptomatic is it doesn't show that much of symptoms. It is very asymptomatic. We don't know the symptoms. Our body won't manifest any symptoms. And you may feel fatigue, and the patient may have mild upper abdominal discomfort and also the elevated liver enzymes. What are the two liver enzymes? ALT and AST, SGOT and SGPT. Like what is that? Systematic glucose liver transferase. So these two enzymes, ALT and AST, are the two liver enzymes. And in a non-alcoholic liver disease, these two enzymes will be in the abnormal range. We can see the increased level of liver enzymes in our body. The second type of fatty liver disease is alcoholic fatty liver disease. The cause of this is obviously, as the name indicates, it is caused due to the chronic excessive alcohol consumption. Okay, so when the person consumes the alcohol for the prolonged period of time, that may lead to the alcoholic fatty liver disease. The symptoms of these are fatigue, loss of appetite, nausea, abdominal pain, and enlarged liver. And next, the second disorder of liver disorder is hepatitis. So, what is hepatitis? What is hepatitis? Anybody? And then what is itis? If anything ends with the itis, that indicates the inflammation on the part. So what is hepatitis? Hepatitis is the inflammation on the liver. It's called as hepatitis. So there are different types of hepatitis condition are there. Hepatitis A, hepatitis B, C, D, and these are all the different types of hepatitis that we have. So the first hepatitis A. Hepatitis A. What is the cause of hepatitis A? Because of the consumption of contaminated food and water, we may get hepatitis A. The symptoms are fever, jaundice, and nausea. And the next type of hepatitis is hepatitis B. The cause of hepatitis B is blood and sexual contact and the use of needles. Again, that is repetitive usage of needles. The symptoms of hepatitis B are fatigue, jaundice, and abdominal pain. And the third type of hepatitis is hepatitis C. The cause is blood transfusion and the needles. The key symptoms are often asymptomatic initially. As the disease progresses, the body will manifest the symptoms like fever and fatigue. And the fourth one is hepatitis B, which occurs only with hepatitis B. This hepatitis B will affect the patient, those who have the hepatitis B, okay? And the symptoms are there is a severe liver damage, okay? And the last form of hepatitis is hepatitis E. The cause of hepatitis E is the drinking of contaminated water. The symptoms of acute jaundice and the fatigue is the symptoms of hepatitis. So these are all the 5 common types of hepatitis: hepatitis A, B, and C, D, and E. And the common symptoms of all these 5 types are jaundice, that is a yellow coloration in the eyes and skin, and the dark urine, pale stool, loss of appetite, nausea, and vomiting. These are all the common symptoms of all the 5 forms of hepatitis. So this is the second disorder of liver disease. And we come to the third disorder, that is cirrhosis of liver. Cirrhosis is nothing but end-stage liver diseases. So that is the end stage of the liver disease. The cause of cirrhosis are due to the chronic alcohol intake, when you have the prolonged hepatitis, the person is infected with hepatitis B and C, that may lead to cirrhosis also. And when the NSALD, that is non-alcoholic fatty liver disease, is not treated initially, when this kind of disease is also progressing in our body, means that will also lead to cirrhosis of liver. And the cirrhosis is also caused by autoimmune liver disorder, which we will be discussing later also. The symptoms of the cirrhosis are there is a severe fatigue, and the patient may have the ascites. What the ascites is the fluid accumulation in the abdomen. They will be having a pot belly. Okay, the patient with cirrhosis will have a pot belly, very big belly. That is because of the accumulation of fluid in the abdomen. The third symptom is the swelling of the legs, and due to the accumulation of the fluid elsewhere in the body, the patient may have swelling in the face, legs, and the abdomen part. And there is a confusion of hepatic encephalopathy. They might be go to some, if it is not treated, means the patient may that may lead to hepatic encephalopathy. The patient will not always look very clear. They will be in a confused state of mind because of the infection in the brain also. And the last symptom of cirrhosis is jaundice. Okay, this is the third liver disease, and the fourth liver disease is the liver cancer. So what is the causes of liver cancer is might be the prolonged cirrhosis, and when there is a chronic hepatitis B and C, and when the patient is having a long-term alcohol abuse, and when the patient is having a progress, that is fatty liver disease. So when these conditions are not treated, cirrhosis of liver and hepatitis B and C, and a prolonged period of alcohol use, and the fatty liver, when the patient have this kind of liver diseases which is not treated initially, and when it is progressive, that may lead to the liver cancer. The symptoms of liver cancers are unexplained weight loss, that is a weight loss, and upper abdominal pain will be there, and there is a abdominal swelling and loss of appetite and the jaundice. So the fifth liver disorder is autoimmune liver diseases. So the types of autoimmune liver diseases are, the first type is autoimmune hepatitis. The second autoimmune liver diseases is PBC. What is PBC? Primary biliary cholangitis. And the third one is PSC, primary sclerosing cholangitis. So these are all the 3 types of autoimmune diseases. So what are they? Autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. These are the 3 types of autoimmune liver diseases. What is the cause of these 3 autoimmune diseases are when there is a problem in the immune system which attacks the liver cells. When the immune system attacks the liver cells, that may lead to the autoimmune liver diseases. The symptoms are fatigue, itching, jaundice, and joint pain. These are all the 4 symptoms of autoimmune liver diseases. And the 6th liver disorder is genetic or metabolic liver disorder. So it may be due to some genetical problem, or it may be due to some metabolical problem, the liver disorder may happen. So the first metabolic disorder is Wilson diseases. We know what is Wilson diseases. It is the accumulation of copper in our body. When there is more copper accumulation was there means that will affect the liver. That particular condition which happens because of the accumulation of copper is called as Wilson diseases. So the symptoms of Wilson diseases is the neurological symptoms and the liver damage will be there. And the second metabolic liver disorder is hemochromatosis. This happens because of iron overload. When there is a too much of consumption of iron in our body, that may also affect the liver. Okay, that condition, the liver damage because of the iron consumption, excess iron consumption is termed as hemochromatosis. The symptoms of the hemochromatosis are fatigue and joint pain. And the third one is alpha-1 antitrypsin deficiency. This is the third level of that is genetic disorder. This is the causes due to the genetical effects only, and this affects the symptoms is there is a liver damage and the lung damage. So these are all the 6 types of liver disorder. So shall we sum up? What are the 6 types of liver disorder? The first one is fatty liver disease. So under fatty liver disease, we have seen 2 types of fatty liver. The first one is non-alcoholic fatty liver disease. The second one is alcoholic fatty liver disease. And the second disorder is hepatitis. We have seen 5 different types of hepatitis: hepatitis A, B, C, D, and E. The third liver disorder is cirrhosis. And the fourth one is liver cancer. And the fifth one is autoimmune liver diseases. So what are the 3 types of autoimmune liver diseases? The first type is autoimmune hepatitis. Second one is primary biliary cholangitis. And the third one is primary sclerosing cholangitis. And the sixth one is genetic and metabolic liver disorder. The first one is Wilson disease that happens because of copper accumulation. And the second one is hemochromatosis that happens due to the excessive consumption of iron. And the third one is the alpha-1 antitrypsin deficiency, which is a genetic disorder of liver. Okay. So what are the common symptoms of this? We have seen disease-wise. We have seen all the 6 types of liver diseases. And disease-wise, we have seen the symptoms. So what is the common symptoms of liver diseases? In summary, what is the common symptoms that we found in the people affected with the liver is fatigue, jaundice, abdominal pain, nausea and vomiting, dark urine, pale stools, swelling of abdomen and legs, and loss of appetite. These are all the common symptoms of liver diseases. So what are the nutritional related causes of this is? All the 6 types of nutrition, that is all the 6 types of liver diseases. What is the nutritional risk is? This can be due to the excess intake of refined carbohydrates, or may due to the excess consumption of saturated and trans fat intake, and when there is a low fiber intake, and when the person consumes excess alcohol, when the person is obese, and if they are found to have insulin resistance, and if there is any micronutrient deficiency, all those things are the nutritional risk factors that contributes to the liver diseases in a patient. So am I clear? Am I fast and slow? Am I fast or slow? Is the liver diseases causes symptoms are clear to you? Please give me some feedback. I just move on to the next topic. So am I audible? Am I fast? Am I clear? Good. Thank you. Thank you. Thank you. So we have seen the different types of liver diseases, its causes and the symptoms. The next comes the principles of diet and dietary modification to all the type of liver disorders. That is whichever in your syllabus. I got the syllabus from Rosalie ma'am, so I am going to cover the diseases that are there in your syllabus. What is the principle of diet and what type of diet modification we can be done. Okay. So the general dietary modification. So before seeing the disease-wise, what is the general dietary principle for liver diseases? Or the liver patients need adequate calories to prevent protein energy malnutrition, and they also need high carbohydrate intake to spare protein. And we need to, for hepatic coma patients, except a hepatic coma patient, we have to give a adequate protein to other type of liver disorder. When the patient is suffering from the hepatic coma, in that case, we have to strictly restrict the protein. for hepatic coma, for rest of the liver disease, we can give adequate protein for all the other liver diseases except the hepatic coma. And there should be a restricted fat intake if fat is intolerance. And adequate vitamins and minerals should be taken. And the patient should take small and frequent meals. And the patient should avoid alcohol completely. These are all the general dietary modifications that can be done by the any type of liver diseases. We will just move on to the dietary modification for each liver disease. Okay, and first we will just check with fatty liver. So as I said, there are two types of fatty liver. One is non-alcoholic fatty liver and the second one is alcoholic fatty liver. Whatever the condition, if the patient comes with the fatty liver, what is the dietary principle is calorie controlled diet. That means the patient should have that is very less amount of calories. Okay, and they have they will have a gradual. Why we are asking them to take a calorie control diet means there should be a gradual weight reduction, and the patient should have a improve insulin sensitivity and should reduce the liver fat accumulation. We will put the patient on calorie control diet. So what is the main dietary principle of fatty liver? We will put the patient on calorie controlled diet because to see the weight reduction and to improve the insulin sensitivity and to reduce the liver fat accumulation, we need to put the patient on calorie control diet if the patient comes with the fatty liver diseases. So the dietary modifications are, the first one is energy. The energy should be, see, first it's mild calorie deficit. We have to increase the we have to decrease the calorie gradually, not very drastically. We should not decrease the calorie if the patient with fatty liver disorder. At least we have to try to 200 to 300 calorie per day. We have to gradually decrease. First 15 days, the patient should be on 200 calories lower than their requirement. Then later we have to go for gradually, we should control the calorie intake. We should not suddenly go for the calorie control diet from 100, 200, 300 up to 500 calories per day. We can control the energy level, that is calorie intake. The carbohydrate should be a high fiber complex carbohydrate should be taken by the patient. Ask them to avoid a refined carbohydrates because all refined carbohydrates are nil in fiber, which cannot help in the progress in the liver diseases. That is, it cannot cure the liver diseases. Only complex carbohydrate will help in curing the liver diseases. So, for regarding carbohydrates, focus on more complex carbohydrates which are high in fiber and protein. So, we should give adequate amount of protein, 1 to 1.2 gram per kg body weight per day is recommended. Okay, and the fat should be moderate. Okay, we give very moderate amount of fat because, and especially avoid saturated and trans fat. Give them, provide the patient with unsaturated fatty acids. Okay, and ask them to include more whole grains, pulses, vegetables, fruits and nuts in our diet because all those items are rich in fiber and all those items are complex carbohydrate which helps to prevent the treat the liver disorder. And ask them to avoid sugar, refined flour, fried fruits and alcohol. Okay, so if the patient comes with any that is fatty liver disease, as they put them in calorie control, give good amount of carbohydrate, this preferably complex carbohydrate, have good amount of protein, preferably 1 to 1.2 gram per kg body weight, and I ask them to include all complex carbohydrate foods like whole grains, pulses, vegetables, fruits and nuts, and ask them to avoid all refined carbohydrates like sugar, refined flour, fried foods and alcohol. The second liver disorder is jaundice. So the dietary principle to jaundice is we have to design a diet which reduce the workload of the liver in our body. Okay, so in such a way our diet should be designed because as I said, liver is the main metabolic organ where all the metabolisms are taken place only in the liver. Metabolism of carbohydrate, protein and fat, all those things happens in the liver. So when the liver is damaged, that is when the patient is having jaundice, so we have to design a diet which reduces the liver workload. It should not further worsen the liver. It should reduce the liver workload and patient should have a progress in their health. And it should also support the liver regeneration and it also helps to prevent the nausea and anorexia. In such a way, you should design a diet for the patient comes with the jaundice. And what are all the dietary modification you can then? Give them a adequate calories. Okay, don't control the calories. Provide them a adequate good amount of calories, and preferably carbohydrates should be a complex carbohydrates which is easily digestible, and moderate protein is 0.8 to 1 gram per kg body weight per day. Protein should be a moderate, and fat as usual. There should be a low fat. If the patient is having any fat intolerance, we have to reduce furthermore low fat. Okay, and ask them to take fruits, fruit juices, buttermilk. They have to hydrate them well. For jaundice, we should ask the patient to drink lot of water. The patient should hydrate them with good amount of fluid. So because of all the yellow color bilirubin will come through the urine. Okay, so we should always advise the patient to take lots of fluids like fruits, fruit juices, buttermilk, condensed tender coconut water. So whatever the fluid that the Moussami juice, whatever it is, they have to take lots and lots of fluids and avoid fried foods, spicy foods, and alcohol. And the third one is hepatitis. So if it is an acute state of hepatitis, the diet should be designed to promote the liver healing and to prevent the diet protein breakdown and to manage the nausea. So what should be the dietary modification for acute hepatitis? Give them the patient with high calorie. So as them to take high calorie diet, and carbohydrate should be adequate. So as usual, 60 to 70% of calories should come from the carbohydrate. Don't give too much of high carbohydrate. Don't give too much of low carbohydrate. Give them a ideal amount of carbohydrate. It is a moderate amount of carbohydrates. Okay. And then protein from moderate to high. If the patient comes with a hepatitis, gradually increase the protein from moderate to high. First start with 0.8, then to 1, and then to 1.2. So for hepatitis, we can gradually increase the protein intake from 0.8 to 1.2 gram kg per kg body weight per day. And fat, as usual, it should be restricted if the patient is poorly tolerated with fat. And vitamins, as usual, they have to take good amount of vitamins and minerals for the regeneration of liver cells. And ask them to take more amount of fluids and soft foods. Avoid taking alcohol, fats, and spicy foods. Okay, then fourth condition is hepatic coma. What does the name indicate? Hepatic coma is as the liver, as I told you, liver is the metabolic organ for carbohydrate, fat, and protein. When if the protein is metabolized, what is the end product of protein metabolism? It's a urea and ammonia. These two are the end product of protein metabolism. If there is any disorder, if there is any damage, or if there is liver is not functioning well, this protein will not be properly metabolized, and all those urea and ammonia will directly pass on to the brain. If the ammonia and urea enters into the brain will get collapsed, and that condition we call it as a hepatic encephalopathy. It refers to the brain. So hepatic encephalopathy is if there is an accumulation of ammonia in the brain because due to the improper metabolism of protein that happens in the liver. So that condition is called hepatic encephalopathy. So for this patient, we have to restrict it because this happens because of what? Because of the improper metabolism of protein. The cause of hepatic encephalopathy is because of protein metabolism. So we should definitely restrict the protein initially as the patient is under the doctor very little amount of protein, that 20 to 30 gram of protein should preferably come from plant protein. Don't give any animal based protein like mutton, chicken, egg during the initial days, because all those animal based protein, all the animal based foods like mutton, chicken, egg, and all, it gives protein. I'm sure that it gives protein, but as well as the animal based foods contains additionally a very high amount of saturated fat. We know that animal based foods are high in cholesterol and fat, right? That too, it is contain only saturated fat. There is no unsaturated fat is present. Sorry. Am I audible? Girls, am I audible?
Yes, ma'am.
Yes. Sorry for the interruption. I just paused it for a while. So for hepatic encephalopathy, so as I said, we should start with the restricted amount of protein, 20 to 30 grams. So though it is a low amount of protein, that low amount of protein should come from plant-based protein. It should not be a animal-based protein, because all animal foods are rich in saturated fat, which is not good for our body. So for that reason, we have to concentrate on plant protein like pulses, legumes, nuts and seeds. Initially, you just feed the patient with plant-based protein, which has got good amount of fiber, which has got that unsaturated fatty acid, which is healthy for our body. Okay, unsaturated fatty acid is healthy, saturated is not healthy. So our plant source contains healthy fat like unsaturated fatty acid. So it is better to have a plant-based protein and give high calories, and fat should be restricted, and ask them to take more fluids and ask them to avoid animal protein and alcohol usage. Okay, so protein should be gradually increased once the condition improves. So under hepatic coma, again and again, I'm just insisting you, please underline it. For hepatic encephalopathy, for this condition, we should restrict the protein initially. Start with 20 to 30 gram per day. Okay, that protein should come from plant-based food. So increase the protein intake once the patient condition improves. If there is any improvement in the patient condition, they gradually increase the protein intake from 30 to 35 grams, 35 to 40. It should not be a drastic increment. Gradually, you should increase the protein 5 to 10 gram per day upon the doctor's advice. Okay. And the fifth condition is cirrhosis of liver. So what should be the diet principle? The diet we are going to design should prevent the malnutrition among patients, and it should also maintain the nitrogen balance, and it also controls the ascites and edema. I know I have already told you ascites is the accumulation of fluid in the abdomen, and edema is the accumulation fluid in the leg and variables throughout the body. So we have to prevent all those major problems. In such a way, we have to design a diet for cirrhosis of liver. And the dietary modification, energy, that is calories should be high. Provide the patient with high calories, and protein, give them a high protein diet, that is 1 to 1.5 gram per kg body weight under encephalopathy. If the patient is having encephalopathy, put a protein restriction. If there is no encephalopathy, give them a high protein diet, that is 1 to 1.5 kg per day. That's not 5 kg, 1 to 1.5 gram per kg per body weight. Okay. And the fat should be moderate, and sodium should be restricted, because if the patient is having ascites, we know that the sodium and water are loving each other. Okay, when there is too much of water accumulation, the sodium will also get accumulated. When there is too much of sodium accumulation, when you take too much of salt intake, the water will also get accumulated. So it is a loving ion. The sodium and the water, they have attracted with each other. So if the patient is having any ascites and edema, restrict the sodium amount, restrict the salt intake. Ask the patient to take 2 grams salt per day. Don't put them on any salt-free diet. Ask them to use 2 grams of salt throughout the day. From morning till evening, ask them to measure 2 grams of salt and put it in the cover. And ask them to cook the food without salt, and avoid, while eating only, they have to sprinkle the salt on the top. Okay, so only 2 to 3 grams of salt is required. That too, doctor will advise upon the patient condition, whether the patient has to take 2 gram or 3 gram or 4 gram. The sodium intake will be decided by the doctor. Okay, so as per the doctor instruction, put the patient on salt restricted diet. Okay, and fluid. If there is a ascites enema, yes, of course, we should restrict the fluids when there is ascites, because already there is a accumulation of water in our body. We should not allow the patient to take too much of fluids. We should restrict the fluids, and vitamins, preferably fat-soluble vitamin supplementation is needed, and meals, ask them to take a small and frequent meals. At a time, they cannot take more because of this ascites and edema. Ask them to take a small and frequent meals with good amount of calories, good amount of protein, and moderate fat, and little sodium. Okay. The last condition is cholecystitis. As the name indicates, the cholecystitis is the inflammation in the gallbladder. This inflammation in the gallbladder leads to cholecystitis. So, how we should design our diet? Our diet should help in the reduction of inflammation in the gallbladder, and it should also prevent the abdomen. So, what type of dietary modification is required is we ask them to take low fat diet because this cholecystitis. The gallbladder is affected. The inflammation is there in the gallbladder. So we have to strictly put the patient on low fat diet with moderate amount of protein and the carbohydrates, which is easily digestible carbohydrates, and include only steamed foods, fruits, and vegetables. Don't take any deep fried and oil items. Avoid taking all animal-based foods, fried foods, whole milk, egg yolk, butter, cheese, and all non-veg items during this cholecystitis. Okay. And the second, that is the next one is next gallbladder disease is cholelithiasis. Cholelithiasis is nothing but formation of stones in the gallbladder. So how our diet should be? Our diet should design to prevent the gallstone formation further, and it also improve the bile flow. So how our diet is supposed to be? It should have a restricted fat, but it should not be a fat-free diet. Put the patient on low fat, but it should not be a fat-free diet, and give them a good amount of fiber and feed them with adequate amount of protein, and ask them to include more amount of whole grains, vegetables, and fruits. And all the fried items should be, and refined carbohydrates should be avoided. Clear? Can I get a feedback from students? So we have seen the dietary principles and dietary modifications of seven different kinds of liver diseases. So is that clear? I request the staff to respond, please. I'm fast, or is it clear? So everything is clear?
Yes, ma'am, it's clear, ma'am.
Okay. The final topic of the liver disorder is pancreatic disorder. Okay. So pancreatic disorder. So we know that pancreas has a exocrine function. It is the exocrine function is it contains all the digestive enzymes like salivary amylase. Pancreatic amylase. Sorry, it's not a salivary. I'm very sorry. Pancreatic amylase, pancreatic lipase, trypsin, chymotrypsin. All digestive enzymes are present only in the pancreas. So it has a very good exocrine functions, and also it has contained endocrine functions in the secretion of hormones like insulin and glucagon. Okay, and which is also this disorders of pancreas. Hello, girls.
Yes, ma'am.
Able to follow me? Yes. So this disorders of pancreas will disturb the digestion, absorption, and glucose regulation, which leads to malnutrition and metabolic complications. So what is the major pancreatic disorder is? The first disorder is acute pancreatitis. Second one is chronic pancreatitis. Third one is pancreatic insufficiency. Fourth one is pancreatic cancer. And the fifth one is diabetes mellitus. These are all the 5 major pancreatic disorders. Let us see one by one about the causes, pathogenesis. Okay. First is the acute pancreatitis. The causes of acute pancreatitis are formation of gallstones and alcohol abuse, high amount of triglycerides in the blood, and due to the drugs like intake of use of drugs like steroids and diuretics, that may also lead to acute pancreatitis, and the condition like trauma and infection that may also lead to acute pancreatitis. And the pathogenesis of acute pancreatitis are it leads to the premature activation of pancreatic enzymes that leads to auto-digestion of pancreatic tissue, and that results in the inflammation, edema, and necrosis in the pancreas. So we will be seeing the inflammation will be there, and there will be a dead cells will be necrosis is nothing but the dead cells, and the edema is accumulation of fluid in the pancreas, and there is an inflammatory response will be high. Then these are all the pathogenesis of acute pancreatitis. So what about the nutritional care? When there is a acute pancreatitis in the acute phase, we have to put the patient on NPO. NPO is nil per oral, that is no food at all. The patient should have a IV fluid. There should be a constant supply of electrolytes. So what is the nutritional care for acute pancreatitis patient? In acute phase, that is early, we have to put the patient on nil per oral. That is, there should not be any food, oral intake of any food. We have to put the patient on IV fluids and electrolytes. When the patients enter into the recovery phase, start the oral feeding as tolerated. Slowly start the oral feeding. First sips of fluids, then clear fluids, then liquid diet, then semi-solid diet, then soft diet, and then normal diet. As the patient tolerated, slowly you just introduce the oral feeding. That feeding should consist of high carbohydrates and low fat diet and with moderate amount of protein. Avoid taking alcohol and fried foods to the patient. So this is the nutritional care we can give for acute pancreatitis. The next condition is chronic pancreatitis. The etiology of chronic pancreatitis are when the pancreatitis is due to the long-term alcoholic intake, when there is a recurrent, that is, it's a frequent episode of alcoholic intake, that can lead to chronic pancreatitis, and prolonged period of smoking, and if there is any genital causes, and if there is any obstruction of pancreatic duct, that may lead to the chronic pancreatitis. So the pathogenesis are, there is a progressive inflammation, fibrosis of pancreas will be seen, and there will be a loss of exocrine and endocrine functions will be seen in the pancreas, and malabsorption will also be seen. Okay. So the nutritional care should be feed the patient. When the patient comes with a chronic pancreatitis, feed the patient, plan a diet with high calorie diet. Okay, feed them with good amount of calories, and protein should be high. That is 1 to 1.5 gram per kg body weight. Put them in a high protein diet, and fat should be restricted. That is 30 to fat should be restricted. It should be less than, it is less than 25 to 20 to 25 grams per day. And there should be a pancreatic enzyme replacement supplement should be there. The doctor will advise about the supplement if the patient needed the supplement. And and provide them a good amount of vitamins and mineral based diet. And again, the meals should be a small and frequent meal. Plan a small and frequent meal and avoid alcohol completely. And the third pancreatic disorder is pancreatic insufficiency. That is the exocrine function. When there is any disturbance in the exocrine function of pancreas, that is, if there is any, what is I already told you, exocrine function is the secretion of digestive enzyme. When there is any problem in secretion of digestive enzyme in the pancreas, that we call it as a pancreatic insufficiency. Okay, during there is a disturbance in the exocrine function. So disturbance in the secretion of digestive enzyme, what could be the causes? The causes of chronic pancreatitis. So when there is a cystic fibrosis, that may lead to the improper secretion of digestive enzyme by the pancreas. And if there is any pancreatic surgery, and if there is any pancreatic cancer, that may lead to the improper, that is there won't be any sufficient secretion of digestive enzymes. Okay. The pathogenesis of this are the reduced secretion of digestive enzymes. Because of the reduced secretion of digestive enzymes, the patients may not complete the digestion of protein, fat, and the carbohydrates. There will be incomplete digestion of all the three macronutrients in our body because of the reduced secretion of digestive enzymes. And there will be steatorrhea. What is steatorrhea? The fat in the stools. The fat will be getting eliminated from the body through the stools. It's called as steatorrhea. The stools, that is the fecal matter, will be white in color. So it is that kind of condition we call it as steatorrhea. What is steatorrhea? Steatorrhea is presence of fat in the stools. Okay, and there will be a weight loss. So what could be the nutritional care is provide the patient with high calorie, high protein with moderate fat, and if the patient needs any enzyme supplementation, the doctor will decide about the enzyme supplementation and provide them with good amount of fiber, vitamins, and minerals. Okay. The fourth pancreatic disorder is pancreatic cancer. When the causes of the pancreatic cancer are smoking. When the patient has a chronic pancreatitis for the prolonged period of time, that may lead to cancer. Diabetes and genetic predisposition and obesity. These five conditions may lead to the pancreatic cancer, and the pathogenesis are malignant, transformation, malignant transformation of pancreatic cells, and there will be obstruction in the bile duct and pancreatic duct. Weight loss with that obstruction of bile duct, that is, the bile duct and the pancreatic duct will get damaged, and there will be a weight loss will also be seen. So the nutritional care is provide the patient with good amount of, that is, high calorie, that should be very good amount of nutrients, that the diet should be nutrient dense. It should contains all vitamins and minerals, and give high amount of protein, fat, moderate fat. Okay. And focus on prevent weight loss, because why I am asking you to provide a high calorie and high protein is, in this condition, in this pancreatic cancer, the patient may, there is more chance for the weight loss. To prevent the weight loss and malnutrition, we should design a diet with high calorie and high protein for the patient comes with the pancreatic cancer. And fifth pancreatic disorder is diabetes mellitus. So we know the cause of diabetes mellitus might be a dysfunction of insulin producing beta cells in the pancreas. So which cell is producing insulin? Which part of the pancreas is secreting insulin? The beta cells. The beta cell which is present in the pancreas helps in the secretion of insulin, which is helps for the blood sugar, which helps to control the blood sugar level in our body. So when there is any damage in the beta cell, that may lead to the secretion of poor secretion of insulin in the body, that leads to the diabetes mellitus. So the pathogenesis is that the insulin deficiency will be there, insulin resistance will be there, and there will be a altered glucose metabolism. So the nutritional care of diabetes mellitus are, we should provide a balanced diet to the diabetes patient, control the carbohydrate, put them on moderate amount of carbohydrate, and specifically prefer them to take complex carbohydrate that presents in whole grains, legumes, and pulses, nuts and seeds. Don't feed them with refined carbohydrates like maida, all white color refined food items. Okay, as if to take more amount of millets, more amount of oats, more amount of broken wheat, which are all complex carbohydrates that also provides a good amount of fiber. When you provide the high fiber diet to the diabetes patient, that helps to control their blood glucose level, and it also increases the, and it also what to say, and the insulin resistance will also not be seen in the patient. So give good amount of fiber, and ask them to follow a regular meal timing. They should follow a regular meal timing, and they should complete the dinner before 7 p.m. to have a blood glucose metabolism. Okay. So these are all the 5 pancreatic disorders, and with this we are completing, and I have to summarize. So above we have seen 5 types of pancreatic disorder. The common nutritional problems in all 5 types of pancreatic disorders are, when the patient comes with any pancreatic problem, so malabsorption will be is seen, and steatorrhea is there, and weight loss will be there, and there is a fat soluble vitamin deficiency, and there will also be a protein energy malnutrition. So these are all the common nutritional problems that seen in the patients comes with pancreatic disorder. Okay. So nutritional care in pancreatic disorder, it focuses on reducing the pancreatic stimulation, and it also corrects the malabsorption to prevent the malnutrition. Thank you. So I have touched base all the mm, topics in your syllabus. Rosalind, any doubts? Rosalind?
Good evening, ma'am.
Yes, Rosalind, I have completed this liver chapter. Any feedback from your side? I will share the notes. I will send a share notes to you, and you can circulate this notes to your students. So, any feedback from your side or any doubts?
Ma'am, good afternoon, ma'am. I'm a student from BHC. I have a doubt regarding the detox diets that is followed in the patient's surroundings, ma'am. Can I ask, ma'am?
What is that? Can you just
Like பேஷண்ட்ஸ் வந்து டீடாக்ஸ் டயட்ஸ்லாம் ஃபாலோ பண்ணுவாங்கல்ல மேம், நார்மலாக இப்போ
ஆமாடா.
ஜென்ரல் யூடியூப்ஸில் பார்த்துட்டு, ஸோ
ஆமா.
அவங்களுக்கு வந்து கான்சிக்வன்சஸ் எவ்வளோ எடுத்துக்கணும் இல்லை
Yes,
எப்படி
yes.
ப்ரொசீஜர்ஸ் இருக்குன்னு தெரியாதுல்ல மேம். ஸோ வாட் வுட் யூ டூ ஃபார் தெம் மேம்? ஹவு வுட் யூ சஜஸ்ட் தோஸ் டயட்ஸ் ஃபார் தெம்?
Detoxic, actually detoxic with a fun now. Go for some herbal drink because some early morning you can take some jeera water instead of taking some pacify. Some fashionable diets are available instead of going for keto, paleo. It's a very good question. I appreciate the candidate who has this question. If you really want to detoxify your body early in the morning, go for the natural type of drinks like this. You can have some fenugreek water, you can have some jeera water, have some lime water, have some mint water, okay, and you can start your day with some herbal tea. Those things are a good detoxifier rather than going for some other detoxification. If you drink this in early in the morning, definitely that will detox your body by eliminating all the toxic items from the toxic substances in your body through the urine. Anything?
Okay மேம், தேங்க்யூ மேம்.
Yes. Anything else?
Ma'am, good evening, ma'am.
Yes, good
This is
evening, ma'am.
Sridhanya. I have a doubt, ma'am.
Yes,
Can I
please.
ask?
Yes, yes, please, ma'am.
Ma'am, from your experience, what is the most important dietary intervention that improves the quality of life in liver disease, ma'am?
Most important dietary intervention, right, for liver diseases,
Ma'am?
right?
Yes,
What
ma'am.
type of intervention? Dietary intervention, as I said, put the patient on preferably a plant-based diet. For my experience, so you have already listened to me, right? I have in few disorders I have told you to insist a plant-based protein for liver
Plant-based.
disorders. Yes, right. So from my experience, if you
Yes,
want me
ma'am.
to ask this, if you see for all the liver disorder, we have to give the patient with high amount of protein, except the hepatic coma. Only hepatic encephalopathy patient need the restricted amount of very less amount of protein initially. As the condition progress, we can increase the protein level. Except a hepatic coma, for all other liver disorder, we have to put the patient on high protein diet. So for me, if you are asking, means ask them to take a plant-based protein more than a animal-based protein. That intervention can really work out. Okay?
Okay, ma'am. Yes, ma'am.
Yes. Any doubts? Anybody else?
Ma'am,
Yes, yes, please.
ma'am, if the
Yes,
patient have
please.
a grade 1 fatty liver means the patient can be curable by the diet.
Yes, definitely. If it is a grade 1 fatty liver, definitely it can be reversible. It can be reversible by giving the dietary management. No need of any medicine. So as the stage progress, we need to give some drugs for the thing. If the patient is diagnosed with a grade 1 fatty liver, definitely it could be treated and prevented, and it can be managed, and also it can be cured due to the diet. That's why I just keep on telling you, you prefer carbohydrates as a complex carbohydrate, ask them to take good amount of complex carbohydrates, good amount of plant-based protein, and good amount of fiber. Okay, ask them to completely avoid, or completely avoid cannot be done, or they can gradually decrease the amount of animal foods. That can be done. Okay.
Okay, ma'am. Thank you, ma'am.
Yes, yes, yes. Anything else?
Ma'am, I have another doubt, ma'am.
Yes. Can you just wait
Ma'am,
for a while? One second, ma. One second, one second.
Sorry, there is a net interruption. Yes, tell me, dear.
மேம் இப்போ சோடியம் ரெஸ்ட்ரிக்ஷன்ஸ் டயட் வந்து இங்கே ஃபாலோ பண்ணுறோம்ல மேம், அப்போ வந்து
ம்.
ஃபுட் வந்து பேஷண்ட்டுக்கு பெலட்டபிளாக இருக்காது. ஸோ அவங்க சாப்பிட மாட்டாங்க, மோஸ்ட் ப்ராபப்ளி அவாய்ட் பண்ணுவாங்க. ஸோ அதை எப்படி மேம் நம்ம வந்து
ம்.
சரி பண்ணலாம்?
அது நம்ம சரி பண்ணணும்னா அவங்க வந்து அதை அடாப்ட் பண்ணிட்டு தான் ஆகணும். தட்ஸ் வை ரொம்ப சால்ட் ஃப்ரீயா எடுத்துக்க கூடாது. டாக்டர் வில் புட் தேம் ஆன் 2 கிராம் ஆர் 3 கிராம் சால்ட். அந்த 2 கிராம் 3 கிராம் சால்ட் நம்ம மெஷர் பண்ணி நம்ம ஒரு பேக்கெட்ல ஒரு பேப்பர்ல மடிச்சு வச்சிடணும். டேக் த ஃபுட். இப்போ ஒரு ஃபேமிலியில ஒரு 5 பேருக்கு சமைக்கிறாங்க அப்படின்னா இந்த டிசீஸ் உப்பு போடுறதுக்கு முன்னாடி அந்த பேஷண்ட்டுக்கான சாப்பாடை வித்தவுட் சால்ட் நம்ம எடுத்து வச்சுக்கணும். மேல நீங்க அந்தந்த மீல் நீங்க பிரேக்ஃபாஸ்ட் லஞ்ச் நீங்க டின்னர் சாப்பிடும் போது அந்த 2 to 3 grams தான் மேல நீங்க ஸ்ப்ரிங்கிள் பண்ணி சாப்பிடுறதுமே தவிர palatable இருக்காதுதான். that I agree, but the patient should follow the sodium restricted diet because of the ascites and edema. So they are allowed to take 2 to 3 grams of salt, and up to 4 grams is also advisable depending upon the ascites and edema in the patient. Okay, so definitely they can sprinkle on the top of the food and they can take, but there is no other remedy. They have to strictly follow this, ma'am.
தேங்க்யூ மேம்.
Okay, ma'am. Anything else?
Thank you, ma'am. Roslyn ma'am has left the meeting due to the technical issues.
No
Thank you
issues,
for
no
the
issues.
informative session, and I'm
Who
sure
is
that
talking?
students.
Who
I'm
is
a
talking?
professor, ma'am, from Food and Nutrition
Yes.
Department.
Okay, your name?
Renita
Your
Angel, ma'am.
yes. Tell me, Rita, how was the session?
Yes, it was very informative and insightful, ma'am, and I'm sure the students were find it helpful, ma'am.
Okay, thank you so much.
Thank you, ma'am.
Thank you.
Can we end the
Thank you
session,
for.
ma'am?
Yes. Thank you.
Yes, ma'am.
That was enlightening section. We have gained deep insights into how diet serves as a cornerstone in managing hepatic disorder. Thank you, ma'am, for patiently addressing all the questions. Give thanks to the Lord, for he is good and his love endures forever. As we draw this program to a closure, I now invite Miss M. Mohanapriya, first M.Sc. Food Science and Nutrition, to propose the vote of thanks.
Good evening, everyone. It's a great honor and privilege for me to deliver the vote of thanks for this special lecture. First and foremost, I would like to thank our God Almighty for His blessings that made today's program a success. I would like to thank our principal, Dr. J. Princy Merlin Ma'am, in her absentia, and college management for providing this platform and constantly encouraging such academic initiatives. A heartfelt thanks to our resource person, Dr. R. Shobana Devi Ma'am from CMC Vellore, for taking time out of her busy schedule to share her profound expertise on therapeutic diet and hepatic disorders. Your insights into the nutritional management of liver health have provided us with a wealth of knowledge that will undoubtedly benefit our future careers in dietetics. I extend my sincere thanks to our head of the department, Ms. C. Roslyn Ma'am, for initiating this program. Her constant support and encouragement gives us light to our future paths. I also extend my thanks to our organizing secretaries, Ms. Shampui ma'am and Ms. Renita Angel ma'am, assistant professors, for organizing this program. I also thank all teaching and non-teaching faculties of our department for their constant support. And last but not the least, I would like to thank my fellow students. Your presence truly made this program memorable. Thank you all once again. Have a great day.
Thank you, Mohanapriya. On behalf of the PG Department of Food and Nutrition, I thank our eminent speaker, Dr. R. Shobana Devi, our faculties, and all the students for making this webinar a success. Before we conclude, I kindly request all the students to fill out the feedback form which has been shared in your respective class groups. Thank you all once again for your active participation and cooperation. Have a healthy and productive day ahead.